it is very clear that the countries that have the best medical systems in the world suffered the most from this disease. Why would that be the case? Already 10 years, people are telling me that in the US and other places that we don't have to worry about diseases because we have the best medical systems. A medical system is not what we need to stop a pandemic. It's a public health system. It's community action. If we wait until people show up in the hospital, it's not a good thing. But that doesn't mean that when people get sick, we don't treat them the best we can. And in order to do that, we not only have to treat them with the tools that we have now, but with tools that we develop over time. And there are many such tools, many such medications, and even other things like doing proning and doing ventilation and doing other things that may help with people who are sick. Um, the convalescent plasma issue itself is something that has not yet clearly demonstrated all of the extent of its capabilities. We are still learning about how to use it. And over time, as we learn how to use particular medications, obviously we should bring them in order to protect the lives of people who have already contracted the disease. It's a big challenge to fight this pandemic. And the fact that India was successful in achieving an almost tenfold decline in cases was very surprising around the world. And many people in the press were dismissing it, saying there must be some magic that was causing it, because how could it have been so successful? And what we did is what I did, and I spoke with Sunil Raina, who is a public health expert in India. And we discussed what had been done, and we put together the method that had been used, including travel restrictions, including very strong lockdowns, and including public communication about precautions like masks, and the collection of actions was readily explaining the success. So we understand where the success comes from. It comes from intentionality, and it comes from hard work, and it comes from understanding what will be successful in the context of a pandemic. Unfortunately, in much of the world, and eventually also in India, there is a perception that there is this balance that is being has to be done between fighting the pandemic and economic activity. And when that happens, people hesitate. They say, well, maybe we'll wait. Maybe we'll wait and see what will happen. What happened is that India got the cases down to about 11,000 cases, and then started to relax restrictions. And as the restrictions were relaxed, the cases increased and rapidly shot up. And now they're over twice as much as they were at the previous peak. And this is a very devastating situation. I was just called by a friend of mine whose parents are now sick. And we are facing a terrible, terrible situation now. But the answer is ultimately the same answer it was before. There is no magic. There is no silver bullet. There is no way to get out of this except to apply the rigorous methods of disease control, public health measures, and we can go through them, and I'm happy to do that in some detail. But the main strategy is to contain the virus geographically. And India has advantages in more limited travel overall, and in the fact that there are areas that the country is huge, of course. So some areas actually achieved elimination. but they were not protected from re-importing, from having cases come back in when the restrictions were relaxed. And this allowed the cases to go up across the country. So the challenge is not to rediscover or to make something new. The challenge is to understand that the methods that are successful are known. They're actually known for thousands of years. We have to apply them carefully, rigorously, with all intention. And India has been successful in applying them, can be successful now, but you cannot be ambiguous. We cannot be um, hesitant about doing this. We have to do it in the best way, in the strongest way, in order to shorten the amount of time. This is the key to success, is to understand that the big price we pay is not in having the restrictions, but in having the restriction extend over time. So by shortening the time, we can be successful and open up to normal activities. And there are other countries that have done this. And even though it's hard, even though it then requires vigilance afterwards to prevent it from happening again, it's still tremendously better than the alternative, which is what we're seeing, which is cases dramatically rising and causing such terrible suffering, deaths, and also long-term disability. And in that, everywhere in the world is the same. India, no different from every other country, will suffer tremendously if it doesn't take the action, and can, if it does, become successful in stopping this outbreak and achieving elimination. Let me then talk a little bit about more specifics of, what needs to be done. The main thing is that what we want to do is to control the geographic spread of the disease. We don't want the disease to go from where it is to where it isn't, from where there's more of it to where there's less of it. The disease is very different from place to place, from state to state, from city to city, from neighborhood to neighborhood, even from local areas. It's very different from location to location. But the challenge that we face is that we don't actually today know where it is. And the reason we don't know today where it is that the information of the cases that we have today has to do with transmission that happened 2 weeks ago, then symptoms started a week ago, and then testing was done, and then we decided that there's positive cases. So it takes time, and in the meantime, they're spreading in space. So the most important thing is to control the spread geographically immediately. And in order to do that, we need travel restrictions as strong as possible between zones, protecting zones from receiving cases from outside. And India had very strong travel restrictions between states, and it should have as small as possible zones where travel is restricted, not to say here we'll do restrictions and here we won't do restrictions, because at the beginning, again, we don't know where the disease is. So we have to have restrictions, and then we want to apply the effort to reduce the number of cases. And to reduce the number of cases, we need to do all of the actions that we've learned, right? First of all, we want to stay apart, people not get together, surely not indoors, but even outdoors, we need precautions. So as little as possible contact between people. Where it's essential, so where there are essential needs like getting food or medicines or other things, essential services, we want to take very strong precautions to avoid transmission. That means wearing masks, having good ventilation, using short amounts of time, staying a distance apart. All of these things that reduce the likelihood that one person breathing out virus will be breathed in by another. Of course, there's also, washing surfaces and hands and so on. But the main thing is we know all of these things. We have to do them very diligently. And in areas where there's high density population, in slums, in other places, high density areas, it's better to be very intensive in identifying who is sick. This should be done in general. We have to identify who is sick and take them, protect them, give them treatment outside of their homes so they don't infect their families. The best thing is to take anybody who's close contact and quarantine them away from others for 2 weeks. And those who are infected have to be treated and cared for until it's clear that they are no longer infectious, which may take 2 weeks, it may take longer. It's important to make sure that those who are sick, we do everything possible so they don't continue to infect others. Another example of what India did right is public communication, making clear that everyone knows what's happening, where the cases are, what they need to do, where they should go for help, how to identify cases. The public communication is super important. None of this is secret, right? Everything we've seen before. It's just, and India has done all of this very well. It's really just about remembering that this is what we have to do. So I'm reviewing it, but these are the things that India did well. It is important to notice that India took um, about, it was from September, October, November, December, January, about 4 months to get down by a factor of 10. If we improve, if we make it better, it can be shortened, and the time can be shortened. And that simply means doing everything even more strongly, doing more carefully, thinking about what can be done in order to reduce the transmission as much as possible. So all of this is something that we know. I could mention that essential services where people have to go to shop and so on, we should be very careful. It's better to have pickup outside rather than people going into a shop. Of course, it's better to have delivery to neighborhoods, and have it distributed in the neighborhood to people. All of these things are things that one can do to improve, but all of these things were done to say how effective India was. The biggest challenge is in the most dense housing in the slums, and in Dharavi, which is considered to be the biggest slum in Asia, it were successful. And to be successful there means that one knows what to do. People went door to door twice a day to find people who were sick. They isolated them away from home. They provided food for everybody. They had all of the things everything that I know to say is something that should have been done was done. So there's people know in India what to do. And again, going back to what needs to be done, it's a community effort. People think that it's a government effort, that it's a health systems effort, and so on. No, it's a community effort, and India has a very strong community health system, and it knows how to protect both urban areas that are high density and rural villages, and from receiving cases, and people know what to do. So I'm reviewing it, but there's nothing new about it. It's all the same things. If India had not known what to do, they wouldn't have been able to do it before. But we have to know that we have to continue until we get to zero. We have to protect zones that are free of the disease very carefully, very diligently. And there are parts of India that are still almost without the disease or without the disease. Now, the area that has been the best over time is the area of Northeast India. But even recently, those areas are now starting to have cases. And so we see that the desire to stop the disease, these are areas where there are under 20 cases per day. Now you see that there are a few states that still have under 20 cases per day, but even there, the cases are starting to increase. And we should protect them, and we should make sure that they stop the cases from growing. And then here, look, Assam now has almost 600 cases per day, and it used to have under 20, right? So the point is that we cannot wait until it grows. We have to stop it now and not wait. And here, all of the places that waited to stop it, right? And of course, Maharashtra, which has 60,000 cases per day now, um, uh, was down at 1,000, 2,000 cases per day. So why did we let it get there? And I was watching the news stories where the leadership was saying, well, we'll wait and see what will happen. At 10,000, we'll wait, 6,000, we'll wait and see. At 10,000, we'll wait and see. Well, we wait and saw, and what did we see? It went up and up. There is no wait and see with a pandemic. The pandemic, what we see now is what happened 2 weeks ago. Already today, it's a lot worse than it was then. And if we don't stop it now, it will get worse next week and the following week. So now it seems that it's beginning to turn over, but you see how far down we have to go now. And so we have to fight and fight and fight and fight. And the main thing now is for people to understand and to make sure that we're not fighting ourselves. Should we reopen? You know, if we get down to half as much as it was, maybe we should reopen. No, it'll go back up. Maybe down to 5,000. No, there is no open until we get to zero if we don't want it to go back up. And this is a lesson. It's a very tough lesson. It's a lesson that's being learned all over the world. And everywhere has to do their best. And again, India can be successful. India can achieve elimination, but we want to achieve it place by place. And even in Maharashtra, right, if we look inside at the district level, there are places that have many more cases and places that have fewer cases. We can look at the neighborhood level. There are places that have many more cases and fewer cases. So the smaller the area that we can allow to open up, the sooner we can allow to open up. What we have to do is to make sure that we eliminate the cases locally, and then we can open up.
Isn't
Please.
it a bit ironic that Maharashtra, Mumbai, Dharavi, which was a success story, it was being quoted as a success story in the world, is one of the worst cases now, worst hit now?
It's tragic. And the answer is the point is that we know how to succeed. There are many places in the world that are confused and are not doing the right thing. India knows how to succeed. So the main point is to use the strengths that India has, to recognize that India has the ability to be successful, and to then have the intention. And we know that the message has been made clear. I've heard the interviews with the Prime Minister, who's been clear about the need for rapid action, strong action. It is unfortunate that the business community doesn't understand always that this should be done. So in Australia and New Zealand, where they have been successful, the business community is the one that told the leadership that they should be taking strong action. Others did too, of course. But they went to the leadership and said, we need to take strong action because otherwise the price that will be paid, both in lives and in economy, will be very high. And so what the most important is that everyone is pushing, everyone, including the people who are afraid of the business consequences of the shutting down, should understand that this is what needs to be done, and all to push in the same direction. We have to get rid of this virus. This is the way to be healthy. This is the way to open the economy. China this year is now growing at 9% per year. And that's because they achieved elimination, and now they're enjoying the benefits of open economy. And we should not be hesitant to learn from places that have been successful. We should learn from the ones that are now enjoying the fruits of success, and we should learn what not to do from Europe and Americas, with the exception of the Atlantic part of Canada. There's part of Canada that has been successful. They've achieved elimination, and they're enjoying the benefits of the health and the economy that is resulting of eliminating the virus. Is it clear?
One more question, if I could. There is a debate in my country these days. Now, see, the power has been given to the states, various states, on how they want to go about it, whether they want a lockdown in phases, complete lockdown, or they don't want any. And some states have gone badly wrong. Delhi opened up when the rest of the country was closing down. So there is a current ongoing debate that maybe the center should take away all the powers. Maybe they should. I mean, is it a case of more political will at the center, or can it be handled this way?
I think people have to understand that there is one policy that works. What is local is what stage of the policy implementation needs to be done. So what's needed is locally different, consistent policy. And the consistent policy can arise because of the central government, or can arise because everybody realizes. For example, in Australia, the federal government was not saying what the right policy was. But all of the states talked to each other and decided what they were going to do. The main thing is that people have to understand that there is only one policy that works. What we see is that at different times, it seems that people are doing different things, which is true. But it's really the same policy, the policy of strongly going down, protecting the borders, and opening up. And so it's the same policy. It may be that one place is open and enjoying economic activity, another place is closed and suppressing the outbreak. But it's still the same policy. It depends upon what's happening with the virus locally. So I don't know whether the right answer in India is to centralize the decision. But I do know that the right answer is to be extremely clear about what is the right policy to do. And that policy is to eliminate the virus, to choose to go to elimination.
Firstly, I would like to ask you, uh, uh, people have been comparing this to other epidemics, like the 1918 flu epidemic, for instance. So at that time, obviously, we didn't have as much travel as we do now. But there is the argument that this is just like another case of bad case of flu, and it will eventually go away, and that there is no need for the economy to take such a hit. What do you say to that kind of argument? That's only my first
It's
question.
clearly wrong, right? It's clearly wrong. But it's in terms of the disease itself. But the point is the following, that the main thing today is that we have understanding. And the understanding that we have shows that we can stop the virus and that it's the best solution. In 1918, we didn't have the ability to get on the phone and talk to the people in China and Australia and find out what they did. Today we do. We had just the fact that we didn't have as much travel, we didn't also have as much knowledge. And the main thing is that we have the opportunity to act together in order to stop this. And with that knowledge, we see what works. We see how terrible it is now in India. We see that letting go the disease is not okay, both in terms of the lives lost and in terms of the economic impact. So if you want to be ignorant, if you want to let the disease do to you what it will, then that's what will happen. But today we have a choice. And it's very clear what the best choice is. The main challenge is doing it together, having the political will, having the intentionality, and achieving it. And as we saw, India has the ability to do that. Does that help?
Yeah.
And one of the things that you said, by the way, was that the flu will become it'll be less severe. It actually turns out that the fact that there's global transportation now makes it worse and worse, right? Because we see that the new variants, because they spread across the world, they actually make the disease much worse. And so one of the things that people don't understand is something that I did research on. The reason why I started doing work on pandemic is because I showed, using mathematical understanding, that exactly what's happening now would happen, which is that instead of diseases becoming less bad, they will become worse because of global transportation. And it's exactly because of what we're seeing now. It's exactly because the worst disease is the one that spreads globally. So it is not the same situation. It's a lot worse. And we need to, if we choose it, the only way to overcome this is the natural course of disease when we have global transportation. It's different than when we don't. And if the only way out of it is by taking action, because otherwise the natural course of the disease will indeed, by definition or by the mathematics, it will get worse and worse, as we see. It's not surprising.
One of the things that I have always been surprised about is the earlier SARS. There was a SARS outbreak way back in 2005, 2006. At that
Yeah.
time, also flights were restricted and so on, but it disappeared as mysteriously as it appeared. What
No,
was
it didn't
going on
disappear
there?
mysteriously.
Okay.
No mystery. People took very strong action in order to stop it. Now, part of it was that it wasn't as confusing as you mentioned. People said 10% of people died from the disease. By the way, this disease is very similar to SARS. It's the same biological process. So if you want to know how bad this disease can get, it may mutate to be 10 times as bad as it is now, because it can become more like the SARS. Then the main thing, however, is that it wasn't as transmitting asymptomatically. So this disease is harder. The COVID is harder to fight because even when people are asymptomatic, they transmit. With SARS, if you detected symptoms early, then you could prevent transmission. That made it easier to stop. But the way it was stopped was by very strong action. It was in multiple countries, Hong Kong and Taiwan, China, and it was in Canada. And it was stopped by people taking strong action. And so it's the rapid response, strong action. And one of the things that happened is that the countries that suffered from it the most, they prepared for the next time that it would happen. And by preparing for the next time, they were ahead of the understanding of the coronavirus. So China did very well because they had the experience of SARS. Same thing about Hong Kong and Taiwan and Singapore, and everyone was saying, we have to be ready for the next time this happens. And that helped a lot. Now, India also has experience with H1N1, with other diseases, and India did reasonably well in fighting other pandemics, including the 1918 pandemic, compared to other places. But the main reason, the starting point, is the fact that India has less travel internally. And because it has less travel internally, it can protect one area from other areas. And so that's super important part of any pandemic response. Does that help?
Yeah, surely. At least it tells us that the SARS-1 was not as bad, was not as benign as it seems to be,
No.
right? No, it was equally bad, and it had enough potential. It
That's
had
right.
sufficient potential, and it was actually stopped. That is the point that you're making.
Absolutely right. Again, the
Yeah.
main point is that diseases do not stop themselves that are very bad. They are stopped by human action. And the more we have global transportation, the more we have to act in order to stop the disease. Because otherwise it spreads very rapidly.
And one final question. You had written a brief paper on fat-tailed nature of epidemics way back in January 2020. Could
Yeah.
you just summarize that for the benefit of our viewers? Thank you.
The main thing is that the beginning of a pandemic does not look bad. There are only a few cases. So if you look and you say, hey, there are a few cases, why should we act? But if you don't act, the cases are multiplied, right? This is what we saw in the cases going like this. It looks very small, but then all of a sudden it's overwhelming. And so the size of the outbreak and the harm that it causes is always difficult to see at the beginning. But the advantage of acting quickly is tremendous, because then you have the best chance to stop it, and indeed the harm will be as little as possible. So the point is that the price at the beginning to stop it seems very high, but the cost, if you don't stop it, becomes much higher. And so it's confusing, right? People are looking at it and saying, you know, it doesn't look so bad. So the idea of the fat tail distribution is that the events that happen that are very bad have to be stopped right at the beginning. So you stop them now, even if it seems to cost very much. How many people would not want to shut down travel for several weeks in order to prevent all of the harm that has happened from the coronavirus that was named afterward COVID? Why did WHO say to people, let's wait and see? Why did the CDC, why did Dr. Fauci, why did experts around the world say, let's wait, maybe it won't be so bad? It's the wrong approach. The approach that we should take is to recognize that when there is unknown disease, is the time to act fastest, to act so to contain the disease and to prevent it from spreading, because the more we let it spread, the harder it will be to stop it. The more we let it grow, the harder it will be to stop it. And we know this about a fire, right? If there's a fire, we don't tell the fireman, let's wait and see how big it gets. You know, we call the firemen early in order to put it out. We put it out sooner. If it's burning a couch, we don't wait and see whether it'll burn the drapes and the house down. And we don't wait to see whether it'll burn the neighbor's house. We put it out. With diseases, we have to treat it like a fire. We have to put it out as fast as possible, make sure that it is contained, and act so that it doesn't spread. There is a subtle scientific point for people who are scientifically oriented. Today, we are seeing the failure of an entire way of doing science based upon statistics, because statistics is based upon the idea that what we've seen in the past is what will tell us what will happen in the future. And it's very clear that that doesn't apply to pandemics. And so we have to separate ourselves from the statistical thinking that dominates in much of academic science. And we need to go back to the understanding that we had about pandemics and about many other real world problems. And the math that will enable us to do it is a different math. It's called complex system science. That's the reason why I work on pandemics, because I've been working on complex system science for over 30 years. Go ahead.
So my question is, I have two, three small questions. Like we have seen in a last lockdown was a successful because many people have savings. They have a very good savings in their accounts. But this lockdown, people don't have any saving. So people are going outside their homes and they are trying to get something because they don't want just food. They want their child to be educated. They want to pay the fees. They want to pay their bills. So it's this time is, you can say, it's very hard to have a lockdown because it's
I agree.
Because it's a very complex situation.
I agree. It's very important what you're saying.
Because means
now,
if they
how
will
do
die,
you solve the problem? Do you solve the
many
problem
people
by
means
not doing it?
if we put the lockdown, many people would die because of hunger. They will not
Right.
die
Well,
because of
it
COVID.
depends how you do the lockdown. Right. This was a problem also in Dharavi. So what did they do? They delivered food to people. Right. So we have to know that there is need for support for people during a lockdown. And the point is that the more we wait to do the right thing, the worse the harm becomes, the harder it is to get it right, the harder it is to be successful. But what we have to do is understand what we need to do in order to be successful. And instead of saying, well, how can we do the lockdown if this and this happens? We have to say, okay, we need to do the lockdown. So what we need to do also is to make sure that people have what they need in order to be able to be in the lockdown. So we have to engage in the challenge from the point of view of success. It's hard to do, but there are these pieces. We need to make sure that people can survive, that people have what to eat, that people are supported in whatever way is necessary, that we'll have to do that. So to say that people are not going to be able to do lockdown is not the answer. We have to say we need to do the lockdown. What will make it possible? And one of the pieces that we should recognize is, again, this piece of time. How much time does it take? India was in a lockdown for something like 5 months longer, right? Why 5 months? Why not 2 months? Why did it take 5 months? Did you think about it? Let's think about it. Could we do better? And the answer is yes. Now, why did the places that didn't have cases not stop the lockdown? They didn't have to have lockdown. Do you know why? And the answer is because people didn't realize that by protecting zones, areas, states, districts that didn't have cases, those places could have returned to normal, pre-pandemic normal. So if you do that, it takes less time, right? Because much of the country doesn't have to be in lockdown more than a few weeks. So if you say, look, I need to get rid of this disease, let's think it through. What do we need to do? We need to get cases down to 0, and then we can open up. So we want to, as quickly as possible, get down to 0 and open up so that people don't have to spend months and months and months in the lockdown, because otherwise they don't have food to eat. They don't have money to buy food or clothes or whatever they need. So the best thing to do is to do it as fast as possible. Is it clear? Because we can support people for 4 weeks, for 6 weeks, for 8 weeks. But if we have to support people for a year, that's going to be much harder. So what we do is we say, okay, so we're going to do the lockdown for as short as possible.
My second question is like we have seen. I have seen some people giving logic that at January and February people were careless and government was also careless. So it gave us the rise in March and April. And now the people are again following the norms and government are also back to a push. So can we say in May and June we can see a shortfall of COVID cases?
So the main thing is that we have to watch, we have to be aware of what's happening. If we do the strong lockdown, within 10 days to 2 weeks, the cases should start going down. And not only that, the cases should go down very quickly once they start going down. Because if we do the right thing, they can go down by over 10% per day. Right now, they've been going up by 10% per day. Right, from yesterday to today, they went from 200,000 to 230,000. That's 15% in one day. It should go down very fast, just like that. So we should be watching the cases going down. And the way to make sure that that happens is indeed to do everything that we can. And if it's not going down that fast, we have to ask, what can we do more to make the cases go down faster?
I was watching news today and I heard that Pfizer is saying that now instead of 2 jabs, we probably would need 3 jabs. And it may also happen that this will become an annual thing, which means to get vaccinated annually. How true is this? That's the first question.
It's a choice. If we let the disease cycle in the population, we will end up with the bad variants that will evade the vaccine and it will treat us very, very badly. If we take action to achieve elimination, then it will not come back. The consequences of this disease are on us. 100 years ago, we didn't know enough to make good choices. Today, we know what's happening. But the choices that we make are not on an individual, they're on the whole country, they're on the state, they're on the city. So the choices that we make together are now the major thing that is affecting our future. And if we make the choice of elimination, then within a few months, the disease can be gone. And then we won't have to have a third shot, or even for many people, maybe even a first shot. It depends. It may be still good to have a vaccination in order to prevent localized outbreaks from happening later. There are other ways to stop it, but that's one choice. The vaccine is a very powerful tool. But if we allow the disease to spread the way it's spreading, we will have variants that will evade the vaccine. And they're talking about another jab. But there's not one variant out there. Maybe there'll be a dozen variants that we have to fight. How will we fight it with the vaccine? We don't know yet. All of that is speculation. The flu that people keep saying is this disease is like, which it isn't, but they keep saying it's like. If we treat it that way, how does the flu behave? It comes back year after year. It kills many people. And if it kills more people, if it kills 10 times as many people or even more as the flu, and it causes the same level of long-term disease, long COVID, it will be very devastating for the society year after year.
One point where with all due respect, I probably would like to disagree is about the lockdown. Because India, unlike other countries, like other developing countries, more than 80% of our workforce is in unorganized sector, and that includes the small and medium enterprise. A lockdown to me looks like where the government does not want to do its own administration job, which is to make sure that the people are wearing masks. Yet there is some communal responsibilities also. How do you see that? Because this is not lockdown in the beginning when you don't know what you are fighting makes sense, but lockdown in the second surge does not make sense to me, or maybe that I'm not looking at it properly. What do you think?
Let me respond to it. There's no place in the world that has been successful in controlling a large number of cases except with a lockdown. No place in the world. It can't be done. The disease transmits before people know they are sick. The disease transmits in mass events. And there is no way that we know to stop its transmitting without using the most aggressive process that we have to stop transmission. It is only by doing the maximum possible that we control this virus. So the benefit is that if we do the maximum possible, then we have to do it for the shortest time. Everything that people do to relax restrictions, say, maybe we don't need to do this, maybe we don't need to do that. It just extends the time that we need to do the lockdown. A soft lockdown where we allow just a little bit of things to happen ends up just keeping the disease around more and more and more cases. And if we do even a little bit less than a soft lockdown, the cases grow explosively. So this idea somehow that we can do masks and a little bit of other things and prevent the transmission has never worked anywhere in the world.
I just wanted to understand the case of China in a bit detail. Because since we share the same, almost similar demography, as well as when it comes to even the level of poverty or the level of population, then in that case also we are a lot similar. However, despite being the origin of the disease, China has been able to handle the situation very better than how India is handling right now.
China was very intentional about its dealing with the virus. Once they understood that it was severe, they responded to it very aggressively. They locked down very strongly. They improved the lockdown over time. So they understood that the way to deal with it was not just to do a lockdown, but to do it better and better over time. So, for example, at first they allowed people to go shopping. Later, they delivered food to neighborhoods so that they wouldn't even have to go shopping. At first, they didn't have best testing, so they developed new testing. They used CAT scans to do testing, CT scan. When they had, and of course, very importantly, they really, really restricted travel. They shut down travel. And in villages, they had people standing at the gates of the villages not letting people in. So they did everything early on. And then, so it took actually 4 weeks in most of the country. I can show you what happened, in fact. You can see the dynamics. So this is the outbreak in China. And along the top here are the different provinces of China. And going down is time. And the time that they locked down was a time when in Hubei they had 105 cases. That was the epicenter. In other places they had less than 20. The cases in Hubei went up to 3,000 cases. Because when you start lockdown, you already have many more cases than you know. But by 4 weeks, in everywhere in China except for Hubei, the epidemic was gone. And Hubei, it took another week. So you see that by 6 weeks, these were already almost all people who were quarantined because they were cases of people who were already infected. So they isolated them and they were already quarantined. By 7 weeks, it was gone. They waited longer before they opened up because they wanted to be sure, because we didn't know enough about the disease to open up yet. Now, if we look at other countries, every country has dynamic that we see like this. This is in Ireland, as an example. There is outbreak, there is lockdown, there is the contraction. This may be imported cases, I don't know, but they achieved elimination here. We know that because genetically these cases are different from these cases. So they achieved elimination, but then they allowed new cases to come in. If we go to other places, this is Switzerland. Again, we have contraction. They basically achieved elimination, but then they allowed it to grow again, like India did. If we go down, this is Italy. They had very slow lockdown, more like India. It took 4 months and they didn't get it. But again, there's the geographical contraction, but again, they opened up. This is Argentina. They prevented the geographical expansion, but they couldn't, unlike India, they had very hard time to stop it in the slums in Buenos Aires. So they didn't stop it very well. This is Russia. They allowed it to propagate all across Russia, the longest country in the world. So every country has this geographical expansion because it starts in some place and then expands from there. And the trick is to prevent it from expanding and to contract it as quickly as possible. Because by contracting it as quickly as possible, we can open up the areas that don't have the disease, and they can return to normal social and economic activities. Is that clear? In Australia, there was outbreak in Melbourne, in the city. But they contained it in Melbourne by setting up a travel restriction that prevented people from going from inside the city to out, from outside the city to in. And so the area outside of the core of Melbourne never had a stage 5 lockdown. It had what's called a stage 3 lockdown. And the other states never had the same lockdown. So it's all about geographical containment. and then acting as strong as possible where the outbreak has happened. And so China did it successfully, showed the world how to be successful, and other places copied them. Taiwan, Singapore, Vietnam, also South Korea, maybe not as quite as well. New Zealand and Australia, the reason why they knew what to do is because they watched China and the success in China. So the capability of doing this is clear, but it takes, I've said it many times, it takes a decision. It takes the understanding that the intention has to be to achieve elimination. And it takes understanding that travel and geographical restriction is the most important tool. And it takes understanding that the action is not really a government action, it's the people action. So it has to be done by community, community by community. In China, there was a person in each neighborhood that was going around in the neighborhood to find cases. But that was also done in India. So the idea is not different, but the understanding that it has to be done all the way with the greatest strength that we have, with all the might that we have socially.
So initially, we were hearing that the strain which was there at in the beginning, it was affecting the elderly population much because of the comorbidities or some other reasons, and hence the Scandinavian nations and even the developed nation in the Europe, they were largely affected in the sense that they had the higher mortality rate than what we were facing in India. But lately, in the past 1 week or so, we have been hearing that the new strain has been affecting the youngsters more, and hence the sudden surge in the cases in India. So, what are your thoughts on the same, sir?
So there's a little bit of some things that one should correct, right? Sweden is the only country in Scandinavia that allowed people to get sick and had huge death rates. The other Scandinavian countries did not. But if you're talking about death rates are affected both by age, by other disease, but also by the kind of care that people are receiving. So in many places, hospitals were overflowed, like they are now in India. And the death rate as a result surely increases dramatically. It is also true that the new variants are affecting children more severely. That's true about the UK variant. It is true about the Brazilian variant and almost surely the South African variant as well. So children are being infected more rapidly and are being affected there. The severity of the disease is higher. And this is a very big deal, obviously, in terms of the overall effects of the disease. But the main thing continues. It's very hard to understand why there developed any attitude that older people are somehow not to be protected. This was strange turn of social values. We know and we value the contributions of our elders in society, their wisdom, and our relationships with them. And we generally consider those relationships to be relationships of care and responsibility. I do not, from the beginning, the narrative that there was some reason not to protect older people is very difficult to understand. And in terms of the consequences of that concept, we have only seen terrible devastation from thinking that we can allow the disease to spread and not worry about the elderly individuals in that context. So I don't think that that's what you're asking directly. You're asking a different question. but I did want to say something about this incredibly awful shift of social value that ended up just hurting all of society, of course, but surely, of course, causing devastation to elderly individuals. But the idea that India, because it has younger population, would be affected less, even that doesn't make sense because, of course, India has many older people. The fact that it's proportionately less should not be understood as being a reason to think that there is a less impact in terms of the society.
One of the things that struck me in this COVID discussion is in the COVID news in general, is the complete invisibility of Africa as a continent. I mean,
Very important.
uh, can you tell us what is similar in Africa and what is unique about Africa? Because
Yeah.
not much information is coming out anyway.
First of all, it's not invisible. I see it because I'm watching. But main reason why people are not paying attention is because India is doing, Africa is doing better. Africa has been doing better than the developed world. And the main reason that they're doing better too is that they have experience with outbreaks. And the second is that they did not take the view at the beginning or much of it of this idea of the trade-off between economics and the disease. Now, there are exceptions. So Tanzania, for example, has done terribly with the outbreak. They allowed the disease to spread, they did not do precautions, and they've suffered terribly the consequences. And there we don't see very much about what's happening because they're not reporting it, but we see some of the consequences. So there are exceptions, but overall, in Africa did quite well in suppressing the outbreak. However, they also have, by and large, not achieved full elimination. And so the complete action of restricting, containing the disease locally and eliminating it locally has been very difficult to finalize in Africa. And I'm unhappy with that situation, but those are the reasons that Africa has been much more successful at fighting this pandemic than the United States and Europe as primary examples.
You talked briefly about WHO's response. If we look at WHO today, it was supposed to be a global body. It was supposed to be a link between developed, developing, and underdeveloped nation. But by involving themselves in the international politics, we all know what has happened. Do you think it is not just hurting the credibility of WHO, but also the question that do we need a body like this? And if so, then how do we make it apolitical so that
Very
they can
important
do their
question.
job?
This is a very important question. And what has happened is that there have grown scientific groups around the world who are providing advice to their governments, sometimes from the inside, often from the outside. Because again, the politics should not be influencing the scientific advice, as you point out. And so this network of scientific groups, starting from Independent Sage in the UK, also the No COVID scientific group in Germany, the ISAC group in Ireland, the No COVID group in Italy. This group of scientists that is providing focused understanding of the scientific aspects of the response has grown spontaneously because of the need to be clear about the science. So the challenge now that you are pointing to is how to create out of this network a global community that will be able to, in the future and in the present, address this pandemic. And this is a group that I'm involved in, and I hope we will learn how to do that well, because we see that it's so important. But I share with you the disappointment, clearly, with the WHO's involvement in politics. And it is a deep and important challenge that we need to address.
How we can see the COVID free world, because many are saying that if a herd immunity is developed, then the COVID would be eradicated, would be not there. So how we can achieve that herd immunity? Because some are saying if all our COVID, or if the COVID spread more, the herd immunity gets more. Or some are saying that complete vaccination is only the process to achieve herd immunity. So can we explain on it?
So the answer is that the way we've achieved eradication of other diseases is by using all of the tools that we have available to us. And there cannot be any secrets about it. But it should be understood, India now, if it achieves elimination, there would be today 50% of the world would be without the disease. Because today 1/4 of the world is without the virus, and India is 1/4 of the world. So this is what we would like to see, both for the health of India and for the health of the world. And if India were to achieve it, and we are hoping that Europe will realize that it can do the same, then all of a sudden the minority of the world has the disease. Can we go further and eliminate it in other countries? And the answer is yes, we can. The smaller is the disease, the weaker it is. So we have the strength. The challenge right now is India. The challenge right now is in Europe. The challenge right now is in Canada. The challenge right now is in every country that is making a decision about whether to go for elimination. And can we achieve elimination, eradication around the world? We can. And part of the reason is that we know how to do it. And part of the reason is that we progressively have more powerful tools. Vaccination is one of those powerful tools. One of those powerful tools that we can use, mass testing, is another very powerful tool. It should be used also in India to help. Another is more effective masks. There are other powerful tools that we're developing, including different kinds of testing, whether it's a sewage testing or surface testing, all kinds of approaches. So we have lots of different new tools that we can use. And I am very certain that if we do what we know today, and if we develop new tools as we can, we will be able to achieve eradication. It will take longer than we want, but it will be possible. And again, the best thing to do is to continue this contraction of the disease. Because as we reduce, one of the main things that we've learned is that as you contract the area of the disease, you can focus all of your efforts on the smaller area and smaller area and smaller area. And that enables you to accelerate the process of achieving elimination and eventually eradication.
Sir, just to add on to what Devansh has already asked, can you just throw some light upon the effectiveness of using convalescent plasma therapy as one of the ways to control the virus?
It's extremely important to continue to find ways to treat people who are sick. we are still at the beginning of understanding what to do. The disease is very severe disease. It was originally thought of it's a lung disease, it's a blood disease, it's an organ disease, it's a brain disease, and a heart disease, and a kidney disease. So we have a tremendously difficult time fighting this disease. And the medical side of this is something that we want to prevent rather than encounter. But we still should do the best we can, right? There's one of the, let me just go back to this statement because it's super important. It is very clear that the countries that have the best medical systems in the world suffered the most from this disease. Why would that be the case? Already 10 years, people are telling me that in the US and other places that we don't have to worry about diseases because we have the best medical systems. A medical system is not what we need to stop a pandemic. It's a public health system. It's community action. If we wait until people show up in the hospital, it's not a good thing. But that doesn't mean that when people get sick, we don't treat them the best we can. And in order to do that, we not only have to treat them with the tools that we have now, but with tools that we develop over time. And there are many such tools, many such medications, and even other things like doing proning and doing ventilation and doing other things that may help with people who are sick. The convalescent plasma issue itself is something that has not yet clearly demonstrated all of the extent of its capabilities. We are still learning about how to use it. And over time, as we learn how to use particular medications, obviously we should bring them in order to protect the lives of people who have already contracted the disease.